So just a little bit about me. Most recently, I have been grooming dogs, which I do love to do, but I needed something with less dog hair and less barking. So I looked into dental hygiene and pretty much jumped right in. Um, and I'm really excited about the opportunities that this career will have for lifelong learning and continuing to grow in this field. So let's take a look back at all that I've learned in this last couple of years. So this first is mandatory reporter training. So this is really important to protect vulnerable populations that are seeing us in the dental chair, and making sure that we know how to identify abuse or neglect and document and report to the proper channels. This is an award-winning medical emergencies video in where we are dealing with a stroke victim in our clinic. So make sure to act fast, recognize facial drooping, slurred speech, arm imbalances, and time to call 911. So please review that. It's a great video. In our lasers case study, we are just making sure that we are getting informed consent for the procedures that we're going to be doing and make sure that our patient confidentiality is always being maintained. This is the first big patient I did in the clinic, the first real patient. I made 1,001 mistakes. I am pretty sure it took me forever to get this patient done. They had pretty complicated mouth, lots of restorations, and I just made mistakes on the hard charting, which led to mistakes on the perio charting, and overall it was just really bad. So I need to take these mistakes and learn from them, grow from them, and know that I'm not going to be perfect as I am learning a new skill. So lots to learn from that experience. Moving on to competency 2. So working with a diverse patient population, we had a great time doing the Special Smiles Health Messenger activity, where we kind of talk to patients that we might be seeing in the dental office that have intellectual and developmental disabilities and how we can best treat them. So just making their experience as comfortable as possible. Moving back to first year, our dental embryology presentation had to do with facial abnormalities, and just like the health messenger activity, kind of figuring out the best way to make these patients comfortable and have a good dental experience. For oral path, I love this class because I love a medical mystery. So for this presentation, we did an unboxing where we revealed little bits of the disease to kind of add up to our differential diagnosis, which was pemphigus vulgaris. So we had a lot of fun with that. And in this next patient case, this was probably my most rewarding patient case in school, a 35-year-old who had schizophrenia. We were doing an SRP on him, my first SRP. He had a panic attack when we did the ASA block, just because he felt like he couldn't breathe. So we had to really work with him, calm him down, get him to get him back in the chair. And I was hoping to bring him back for a re-eval, but he had a hospitalization due to schizophrenia, couldn't come back, but I did get him this last year for a recare this last semester, and he was so glad to be back and seeing us. He was doing great. He definitely just kind of missed out on some home care during that hospitalization, but I was just so glad that he was back and doing well and excited to be back in the dental clinic. Moving on to competency 3, so about dental hygiene knowledge and skill. So smoking cessation is really important that we share this with our patients just because it is the leading modifiable risk factor for several systemic diseases. So using the Fagerstrom questionnaire and other questionnaires to kind of determine the dependence of our patients so we can make a plan for them. So this was just great practice on how we can get our patients to think about stopping smoking. In regards to a bit more with our special needs populations, we looked at the autism spectrum and how to work with caregivers and patients that might have autism, and how to create plans for them to make home care a little bit easier. So behavior modification is really key for that. And then we did do a lot of training on our special needs populations. These are a couple trainings we did about making the dental office inclusive for our special needs patients, and then also working with caregivers and families to help with their home care. I had worked pretty extensively in college and after college with people with special needs, so I really enjoyed kind of revisiting this again. So this next patient case, just looking at him, pretty healthy 20-year-old kid, nothing too exciting. But then when I got to his radiographs, I had some surprises, which was really exciting. So here we have his maxillary canine just hanging up here by his sinuses. And then he has these really cool dilacerations and then these like little bone defects. And looking at these with Dr. Macri, he was showing me that there's actually retained root tips from baby teeth that just never exfoliated. So that's what's causing these permanent teeth to kind of grow in a little funny. So he definitely recommended that he get those taken care of when he gets his wisdom teeth out. So he had a bit of restorations that needed to be completed. It was also interesting to see these elevated probe depths around these defects. So really unusual, something I hadn't seen before, and I thought it was so interesting. Moving on to competency 4, this is also about treating different populations in different settings. So we worked with a local Boy Scout troop to get their dental merit badge. So for that, we did a presentation on dental health and a variety of topics that they needed to cover in their dentistry merit badge. So they all got a packet where they had to go over tooth anatomy, gum disease, a lot of different things. So I was shocked at how engaged the kids were. They had amazing questions, and it was really fun to see like some of the shyer kids kind of come out of their shell, ask questions, and share their experiences. So we really enjoyed doing that. We also looked at the future of teledentistry. The really amazing thing about technology is we can hopefully bring a little bit better care to people in rural or underserved areas, or maybe older populations who may be homebound. So technology is really kind of changing the way we can perform some aspects of dentistry. For Community 2, we did a teen oral health education outreach with our Teen Teeth Talk. So we covered factors that are important to teenagers, such as nutrition, HPV, and vaping. And we did it based on a way that's pretty communicative and non-judgmental, in a way that the teens will hopefully feel supported and not judged. Natasha and I were able to go to a Special Smiles volleyball tournament, and that was so fun. We did dental screenings and then also OHI, and gave every participant that came to visit us a little goodie bag along with fluoride treatment, where we told them or their caregivers how to apply that. So it was a really fun afternoon. And then for my special needs competency, I worked with an 80-year-old man who was recently diagnosed with Parkinson's, and he was so sweet, and he had been coming to the clinic for quite some time, so the faculty was very familiar with him. He also has stage 3 periodontitis, and it was really nice that the faculty was so familiar with him, because they were able to notice declines in his function more than I would, just because they had such a great history with him. So I'm really looking forward to building these relationships with patients, so we can kind of see if anything is out of the ordinary. So really, really great guy. Loved him. Moving on to competency 5, about lifelong learning. So this was one of our very early assignments in anatomy, and that was our tooth drawings. I'm not the best artist, but I'm so proud of these drawings. But I just had to remind myself, like, do your best. And what's most important with these is paying really close attention to detail. So if you make one little mistake, you can throw everything off. So I think this wasn't only about recognizing normal anatomy, but also just working on paying really close attention to detail. So not too bad. I think the drawings are pretty good. Pretty proud of myself. This was probably one of my favorite, but also most complicated projects, and I did a report on GLP-1s and periodontitis. So GLP-1s are going to be huge in the future. They're going like crazy now, but there's just so much more we can learn about them, and they're not just for diabetes anymore. There's a lot of research around inflammation, and so looking at inflammation and the time with perio, these GLP-1s can help, which is super exciting. So with RMDC, went with a couple of classmates this year, and we had a great time. I did a master class on dental hygiene. That was a morning afternoon session. I got some things out of it, but a lot of this I felt like we had covered extensively in school. So it really just hammers home the fact that what we're doing in class is the most current, most up to date. With Alpine, we attended virtually for this, and I was really excited to learn about different pathways we can have, just so we don't stay stagnant in our careers. So another patient case, this was my timed new patient, and I just really felt like this was kind of where I hit my stride. Time was always really hard for me, and I hard charted this like so quickly. I was so proud of myself, considering I had struggled so much earlier in the year, and I got her done in, I believe, like 82 minutes. So super proud of how far I'd come and how confident I felt with that case. And our final competencies, getting ready for our boards. So fall scaling competency, with this, I feel like it was our first true test of our skills. So I was really happy that I got a pretty decent score on my first attempt, and it really just kind of gave me the confidence that I was actually knowing what I was doing. So I did the Andes RDH's board prep in North Carolina. I got to visit with some of my old friends. I lived in this area for about 7 years prior to moving back to Colorado. I got to visit with old friends. I went to visit my old shop that I started. The new owner had dinner with a bunch of people. It was amazing. But I also learned a ton at Andy, which I guess is the more important thing. Mock credits. This was super hard for me just because I hadn't played with a typodont in months, maybe over a year. It was a long time. So that gingiva felt really funny. So, you know, it was just a great learning experience and getting us ready for the credits. And boards. So excited I passed. It was really hard. I was just so not sure if I'd studied enough, prepared enough, but I did it, and I'm really happy that I passed. So final patient case to talk about today is my last SRP that I did, and I was so excited because she was going to be able to come back for her reevaluation, but of course she canceled like 2 hours before. But I really felt like I had some great like aha moments with this case in both like my calc detection and also my scaling. She had some really tenacious calculus, but we managed it. So that is my portfolio, and I just am amazed at how much I've learned over the last couple of years from going to like never putting my hand in a stranger's mouth to doing SRPs, and I felt like I had a lot of curveballs, learning challenges, but I'm really proud of how far I've come, and I can't wait to continue learning in this profession.